The color drained from Dr. Victoria Chen's face as she turned to see 5 members of the hospital board standing in the emergency department corridor. Her mouth opened, but no words escaped. 8 years of impeccable service, countless lives saved, a reputation built on surgical precision. All of it crumbling in the space of a single heartbeat. My office. Now. Dr. Marcus Thornwell's voice was quiet, but it carried the weight of finality. Just moments earlier, Victoria had refused to treat a patient. Not because she lacked the skill. Not because the emergency room was overwhelmed. But because the 73-year-old man sitting on the examination table was dirty, disheveled, and reeked of the streets. I'm not treating him, she'd said, loud enough for everyone to hear. He needs to shower first. What she didn't know was that the dirty old man she'd dismissed wasn't just another homeless person. He was clutching his chest because his heart was failing. And the board members she now faced had heard every single word of her refusal. But here's the twist that makes this story unforgettable. Raymond Dalton's identity would shock everyone in that hospital, including the doctor who'd just sealed her own fate. If you want to see how a single moment of judgment destroyed one career while revealing an extraordinary hidden truth, hit that subscribe button right now. Because what happens next will challenge everything you think you know about the people we pass by every single day. The question isn't just what happened. It's how did we get here? To understand how everything fell apart, you need to know who Dr. Victoria Chen was before that fateful Thursday afternoon. Memorial Grace Hospital stood as a beacon of hope in the community. A 200-bed facility known for treating everyone who walked through its doors, regardless of their ability to pay. The hospital's mission statement was emblazoned in the main lobby. Healing with dignity, serving with compassion. For 8 years, Dr. Victoria Chen had embodied those words. When Victoria first arrived at Memorial Grace fresh out of her residency, she was everything a hospital could want. Her diagnostic skills were razor-sharp, her surgical precision legendary. Colleagues would later recall how she'd spend extra time with frightened patients, explaining procedures in language they could understand. She volunteered for the overnight shifts no one else wanted. She remembered birthdays, asked about family members, and had a genuine smile that could calm even the most anxious patient. But somewhere along the way something changed. Year 3 brought a particularly brutal winter. A flu epidemic that pushed the emergency department beyond its limits. Victoria worked 70-hour weeks, watching patients die in hallways because there weren't enough beds. Year 5 brought the opioid crisis in full force. She treated the same overdose patients repeatedly, reviving them only to see them back within weeks, sometimes days. The gratitude she'd once received was replaced by entitled demands, threats from intoxicated patients, and the soul-crushing realization that some people seemed determined to destroy themselves no matter what she did. Her colleagues noticed the shift. The warm smiles became rare. The extra time spent comforting patients disappeared. Victoria became efficient, clinical, detached. She still made the right diagnoses and performed flawlessly, but the compassion had leaked out of her like air from a slow puncture. Some whispered that she'd become jaded. Others said it was burnout. A few defended her, saying she was simply protecting herself from the emotional toll that destroyed so many doctors. The truth was probably all of these things. Victoria had begun to categorize patients in her mind. The deserving and the undeserving. The elderly woman with a broken hip who'd slipped on ice? Deserving. The businessman having a heart attack? Deserving. But the homeless man who came in every week with alcohol poisoning? The drug user seeking pain medication? The uninsured patient with preventable diabetes complications? Something inside Victoria had started to harden against them. She never said it out loud. She still treated these patients, most of the time. But her empathy, once boundless, had calcified into resentment. This particular Thursday had pushed her to the edge. Dr. Harrison had called in sick at the last minute, leaving Victoria to cover both their shifts. She'd been at the hospital for 16 hours straight. The emergency department was absolute chaos. Ambulances screaming into the bay every few minutes, the waiting room overflowing with 40 patients, nurses running between examination rooms like they were fighting a war. Victoria had treated a stabbing victim, a child with a severe allergic reaction, 2 car accident casualties, and a woman in diabetic shock. Her feet ached. Her head pounded. The coffee she'd consumed had stopped working hours ago, leaving only jittery exhaustion in its wake. She was running on fumes and fraying nerves when Raymond Dalton shuffled through those automatic doors. And that's when her worst self emerged at the worst possible moment. The automatic doors of Memorial Grace's emergency department slid open with their familiar whoosh, and Raymond Dalton stepped inside. The smell hit first. It was the pungent, unmistakable odor of someone who hadn't bathed in weeks, a mixture of sweat, urine, and the particular staleness that comes from sleeping in the same clothes day after day. Heads turned in the crowded waiting room. A mother pulled her child closer. A young man scrolled faster on his phone, eyes deliberately averted. An elderly couple shifted seats, moving several chairs away. No one said anything, but the message was clear. You don't belong here. Raymond didn't seem to notice. Or perhaps he'd simply grown accustomed to it. At 73 years old, he looked like a man who'd been weathered by decades of hard living. His clothes hung off his thin frame, a jacket held together with safety pins, pants stained with substances better left unidentified, shoes with soles that flapped open like hungry mouths. His hair fell in greasy, matted tangles around a face carved deep with wrinkles. Dirt was caked under his fingernails and in every crease of his weathered hands. But it was the way he held himself that should have caught everyone's attention. Raymond clutched his left arm awkwardly against his chest, his fingers pressed into his shoulder. His face was gray, not just dirty but ashen, with a sheen of sweat across his forehead despite the cool hospital air. Each step seemed to require immense effort, and his breathing came in short, careful gasps, as if he was afraid a deep breath might shatter something inside him. Jenny Martinez, the triage nurse on duty, saw him immediately. While others in the waiting room turned away, Jenny stood up and walked directly toward him. She'd been a nurse for 12 years and had learned long ago that the sickest patients often looked the least conventional. "Sir, I need you to come with me right away," she said, her voice calm but urgent. Raymond's voice came out in a gravelly whisper. "My chest. It hurts real bad. Started about 3 hours ago. Thought it would pass, but..." He grimaced, his knees buckling slightly. Jenny caught his elbow, steadying him. "Your left arm. Is it numb? Tingling?" "Yeah," Raymond nodded. "Can't feel my fingers no more." Jenny's eyes widened. Every nurse and doctor knows these signs. Chest pain radiating to the left arm. Shortness of breath. Sweating. Pale, clammy skin. These weren't just symptoms. They were red flags screaming one diagnosis. Myocardial infarction. A heart attack. And time was everything. The first hour after heart attack symptoms begin is called the golden hour. Every minute that passes without treatment means more heart muscle dies. Blood flow needs to be restored immediately to prevent permanent damage or death. Raymond had already waited 3 hours. He was well past the optimal window. "We need to get you examined right now," Jenny said, guiding him past the waiting room toward the examination area. She flagged him as priority 1, the highest urgency level. Raymond shuffled alongside her, clutching his arm tighter. He had no idea that his heart muscle was dying with each passing second. No idea that the next few minutes would determine whether he lived or died. No idea that the doctor assigned to his case was about to make a decision that would change multiple lives forever. He simply focused on taking the next breath, and the next, unaware that his life hung by a thread growing thinner with each heartbeat. Jenny guided Raymond into examination room 7 and helped him onto the table. "A doctor will be with you in just a moment," she assured him, already reaching for the blood pressure cuff. His BP was elevated, 152/98. Another concerning sign. She clipped a pulse oximeter to his finger. Oxygen saturation, 94%. Lower than ideal. "Dr. Chen," Jenny called out, spotting Victoria passing by the nurse's station. Room 7. 73-year-old male, chest pain radiating to left arm, onset 3 hours ago. Possible MI. Victoria glanced at her tablet, scrolling through the mounting list of patients. She was so tired she could barely focus on the screen. Another patient. Another problem. She took a breath and walked toward examination room 7. The moment she pulled back the curtain, her face changed. Raymond sat on the examination table, still clutching his arm, his dirty clothes leaving smudges on the white paper covering. The smell from the waiting room had concentrated in the small space. Victoria's exhausted mind didn't see a man in cardiac distress. She saw a problem she didn't want to deal with. "I'm not treating him." The words came out flat, cold, final. Jenny froze, her hand still on Raymond's shoulder. "I'm sorry." "You heard me," Victoria said, louder now, making no effort to lower her voice. Raymond sat right there 3 feet away, hearing every word. "He needs to shower first. This is a sterile environment, and I won't risk contamination for someone who can't be bothered with basic hygiene." Raymond's eyes dropped to the floor. His jaw tightened slightly, but he said nothing. It was the reaction of someone who'd heard this kind of rejection before, someone who'd learned that arguing only made things worse. He simply sat there, still holding his dying arm, absorbing the humiliation in silence. Jenny's face flushed red. "Dr. Chen, his symptoms: chest pain, arm numbness, diaphoresis. These are classic signs of a myocardial infarction. We need to get an EKG, start him on aspirin, get blood work for troponin levels." "I said no," Victoria interrupted, her voice sharp as a scalpel. "There are other patients in this department who actually take care of themselves. People who deserve immediate attention. Get him cleaned up, then maybe we'll talk. Or better yet, refer him to the free clinic downtown. They're equipped to handle this." She gestured vaguely at Raymond, as if he were an object rather than a person. Jenny's professionalism was cracking. "Doctor, every minute we delay. Are you questioning my judgment, Nurse Martinez?" The use of Jenny's formal title was a weapon, a reminder of the hierarchy. Jenny's mouth opened, then closed. She was trapped between her duty to the patient and the reality that she couldn't override a physician's decision, no matter how wrong it was. Raymond finally spoke, his voice barely above a whisper. "It's all right, miss. I can go." He started to slide off the examination table, moving slowly, carefully, as if any sudden movement might break him. "Sir, please don't." Jenny reached for him, but Raymond was already standing, swaying slightly. "I've dealt with worse than this," he said quietly, though his face had gone even paler, if that was possible. There was no anger in his voice, no indignation. Just a bone-deep weariness, the acceptance of someone who'd been made to feel less than human so many times that it had become normal. Every second that ticked by meant more damage to Raymond's heart. The left anterior descending artery, the one doctors grimly call the widowmaker, was likely blocked. His heart muscle was screaming for oxygen it wasn't getting. Cells were dying by the thousands. And Dr. Victoria Chen was walking away. "Here's a question for you. Have you ever witnessed discrimination in healthcare? Have you or someone you know been judged by appearance rather than symptoms? Drop your thoughts in the comments below, because what happened next proves why this matters more than you might think." Jenny stood in that examination room, watching Raymond clutch his chest, watching Dr. Chen disappear down the corridor and feeling utterly helpless. But neither of them knew that 5 people had heard the entire exchange. 5 people who were about to change everything. The man Dr. Chen had just dismissed as unworthy of care had a story she never bothered to ask about. Raymond Dalton wasn't born on the streets. 50 years earlier, he'd been a young man with a sharp mind and ambitious dreams, studying civil engineering at State University on a partial scholarship. But in 1968, those dreams were interrupted by a draft notice. At 21 years old, Raymond found himself in the jungles of Vietnam, serving 2 tours as a combat engineer. He came home in 1970 with medals he never displayed and nightmares he never discussed. While other veterans struggled to reintegrate, Raymond threw himself into his work. He joined the city's Department of Public Works and quickly became one of their most talented engineers. His specialty: water treatment and distribution systems. For 28 years, Raymond designed and oversaw the infrastructure that brought clean water to hundreds of thousands of homes. The expansion of the Riverside Treatment Facility? That was Raymond's design. The updated pipe system that reduced water loss by 30%? Raymond's innovation. He worked with precision and dedication. The same qualities that had kept him alive in Vietnam now channeled into keeping his community healthy. And here's the cruel irony. The man Dr. Chen refused to treat had literally built the very pipes that brought water to Memorial Grace Hospital. The sink where she'd washed her hands before countless surgeries? Connected to a system Raymond had engineered. The sterile environment she claimed to protect? Made possible in part by his life's work. But Raymond's carefully constructed life had a foundation more fragile than anyone realized. His wife, Margaret, had been his anchor for 42 years. High school sweethearts who'd weathered Vietnam, raised 2 daughters, and built a quiet, stable life together. When she died suddenly from a stroke 3 years ago, something inside Raymond shattered. The PTSD he'd managed to contain for decades came flooding back. The nightmares intensified. He started drinking to sleep, then drinking to function. His daughters tried to help, but Raymond pushed them away, drowning in shame that he couldn't cope. When he lost his job due to his drinking, he lost his identity. When he couldn't pay his mortgage, he lost his home. When he emptied his savings on alcohol, he lost his last safety net. The descent into homelessness happened faster than anyone could have imagined. This isn't uncommon. Right now, approximately 33,000 veterans are experiencing homelessness in America on any given night. That's 33,000 men and women who served their country, now sleeping in shelters, cars, or on the streets. Many, like Raymond, suffer from PTSD, depression, or substance abuse. Invisible wounds from service that society often fails to acknowledge or treat. Mental health issues affect nearly 70% of homeless veterans. These aren't people who chose to fail. They're people who served, sacrificed, and then fell through the cracks of a system that didn't catch them. Raymond's daughters had tried everything: rehab programs, veteran services, temporary housing. But without Raymond's willingness to accept help, their efforts went nowhere. Eventually, consumed by guilt and despair, he'd stopped answering their calls. He'd convinced himself they were better off without him, that he was too broken to deserve their love. For the past 18 months, Raymond had been living on the streets, shuffling between shelters and sleeping under bridges. The brilliant engineer who'd once solved complex problems now struggled to remember when he'd last eaten. The veteran who'd survived combat now found himself defeated by shame and grief. But even at his lowest, Raymond hadn't lost his humanity. Other homeless individuals knew him as someone who shared his food, who checked on the elderly folks in the shelter, who still said, "Please," and "Thank you," even when the world had stopped extending him the same courtesy. This was the man lying on that examination table, his heart failing, being dismissed as not worth treating. The man whose dignity had been stripped away by tragedy, now having what little remained taken by a doctor's prejudice. Standing just 15 feet away from examination room 7, partially obscured by a medical equipment cart, were 5 people who'd heard every single word of Dr. Chen's refusal. Dr. Marcus Thornwell, president of Memorial Grace Hospital, stood frozen in disbelief. Beside him were 4 members of the hospital's board of directors: Patricia Nguyen, the board chair and a retired federal judge; Robert Castellano, a healthcare policy expert; Dr. Sarah Kim, chief of the hospital's community health initiatives; and James Wright, a philanthropist whose donations had funded the hospital's homeless outreach program. They'd arrived at the emergency department 10 minutes earlier as part of an unannounced inspection, a practice Dr. Thornwell insisted on to see the hospital operating in its natural state, not polished for VIP visits. They were there to review the new trauma center expansion, assess workflow efficiency, and observe patient care standards firsthand. Instead, they'd witnessed a fundamental violation of everything Memorial Grace stood for. Dr. Thornwell had built his entire career on a simple principle: every human being deserves dignity in healthcare. When he became hospital president 8 years ago, he'd immediately implemented comprehensive policies to back up that belief. Memorial Grace's non-discrimination policy was clear and unambiguous. No patient shall be refused treatment based on race, religion, gender, sexual orientation, socioeconomic status, housing situation, or physical appearance. It wasn't just words on paper. Thornwell had established a free clinic for uninsured patients, created partnerships with homeless shelters, and trained staff specifically on treating vulnerable populations without judgment. He'd fought the board when they worried about costs. He'd defended his vision when other hospitals questioned the financial wisdom of treating patients who couldn't pay. A hospital that turns away the vulnerable isn't a hospital, he'd said during one particularly contentious board meeting. It's just a business with medical equipment. That philosophy had made Memorial Grace a beacon in the community. Homeless advocacy groups recommended it. Veterans organizations trusted it. The hospital had won awards for equitable care. And now, Dr. Thornwell had just watched one of his own physicians violate every principle he'd fought to establish. Patricia Nguyen's hand trembled slightly as she clutched her tablet. As a judge, she'd seen discrimination in countless forms, but hearing it spoken so casually, with a dying man sitting right there, shook her. Robert Castellano's jaw was clenched tight. Dr. Sarah Kim looked like she might be sick. She'd personally designed training programs to prevent exactly this scenario. James Wright's face had gone pale. He'd donated $2 million to create programs serving homeless patients specifically because his own brother had died on the streets, refused care at a different hospital years ago. Hearing those same callous words come from a Memorial Grace physician felt like a betrayal of everything his brother's death had meant. Did she just... Patricia whispered, unable to finish the sentence. Yes, Dr. Thornwell said quietly, his voice tight with controlled anger. She did. They watched as Raymond Dalton began to slide off the examination table, preparing to leave despite his obvious distress. They watched Nurse Martinez's helpless frustration. They watched Dr. Chen walk away as if she'd simply declined to refill a prescription, not potentially condemned a man to death. Dr. Thornwell took a deep breath. He'd spent his career advocating for policy changes, writing procedures, giving speeches about healthcare equity. Now he had to do something much harder. He had to act. Stay here, he told the board members. Then he stepped forward into the corridor, his voice cutting through the emergency department chaos. Dr. Chen. Victoria turned at the sound of her name, and the world seemed to tilt on its axis. Dr. Marcus Thornwell stood in the corridor, flanked by members of the hospital board. Their faces told her everything she needed to know. Patricia Nguyen's expression was one of pure disappointment. Dr. Sarah Kim looked stricken. James Wright's eyes burned with an anger that made Victoria's stomach drop. But it was Dr. Thornwell's face that truly terrified her. Not angry, not shouting, just deeply, profoundly grave. The color drained from Victoria's face as the realization crashed over her. They'd heard. They'd heard everything. My office. Now. Dr. Thornwell's voice was quiet, but it carried the weight of absolute finality. Victoria's mouth opened. No words came out. Her mind raced, searching for an explanation, a justification, anything that could undo the last 5 minutes. The exhaustion she'd felt moments ago vanished, replaced by cold, electric fear. 8 years. 8 years of building her career, her reputation, her life at this hospital. Evaporating in seconds. Dr. Thornwell, I can explain, she started. My office, he repeated, his tone leaving no room for discussion. Then he turned to Jenny Martinez, who still stood in examination room 7 with Raymond. Jenny, get Dr. Patterson to treat Mr. Dalton immediately. Full cardiac workup, EKG, troponin levels, aspirin, the works. Tell him it's priority 1, my direct order. Yes, sir, Jenny said, relief flooding her voice. She was already reaching for her phone. As Dr. Thornwell began walking toward the administrative wing, Victoria followed, her legs moving automatically. The emergency department seemed to blur around her. She was vaguely aware of nurses pausing in their work, of curious glances following her. Word would spread through the hospital within the hour. Everyone would know. Her mind spiraled through the implications. Termination. The end of her career at Memorial Grace. But worse, much worse, was what this would mean for her medical license. A firing for refusing to treat a patient? That would go on her record. The state medical board would investigate. Other hospitals would see it. Her entire future, everything she'd worked for since medical school, was collapsing like a house of cards. And underneath the panic, a small voice whispered something she didn't want to acknowledge. She deserved this. She'd crossed a line. Not just hospital policy, but something deeper. She'd looked at another human being in crisis and deemed him unworthy. She'd let her exhaustion, her burnout, her accumulated resentments transform her into someone she didn't recognize. Someone cruel. The walk to Dr. Thornwell's office felt like a funeral march. Meanwhile, back in examination room 7, Dr. James Patterson arrived at a run. At 56 years old and 20 years into his career, Patterson had seen his share of emergencies, but Jenny's urgent page had triggered his instincts immediately. Talk to me, he said, already pulling on gloves. 73-year-old male, chest pain for 3 hours, radiating to left arm, numbness, diaphoresis. Jenny rattled off, hooking Raymond up to the EKG machine. Dr. Patterson looked at Raymond, really looked at him, seeing past the dirty clothes and unwashed hair to the gray pallor, the labored breathing, the classic presentation of a man whose heart was in crisis. Sir, I'm Dr. Patterson. We're going to take care of you. Can you tell me on a scale of 1 to 10, how bad is the pain? 8, Raymond gasped. Maybe 9. Okay. Jenny, let's get him on oxygen, 324 milligrams of aspirin, and I want that EKG now. Patterson's hands moved with practiced efficiency, his voice calm and reassuring. You're in the right place, sir. We've got you. The EKG machine began printing, and Dr. Patterson's eyes scanned the readout. His expression tightened. ST elevation. We've got a STEMI. Call the cath lab. Tell them we're coming up now. Raymond Dalton was finally getting the care that might save his life. If you believe every person deserves to be treated with dignity, regardless of how they look or where they come from, hit that like button right now. Because what happens in Dr. Thornwell's office is about to prove why these values matter. The question was, would it be in time? In the cardiac catheterization lab on Memorial Grace's 4th floor, Dr. Patterson and his team worked with focused intensity. They'd inserted a thin tube through Raymond's femoral artery, threading it up to his heart to locate the blockage. The images on the screen confirmed what the EKG had suggested. Raymond's left anterior descending artery, the Widowmaker, was 95% blocked. "Deploying stent," Dr. Patterson announced. Within minutes, blood flow was restored. Raymond's heart, which had been starving for oxygen, could finally breathe again. He'd suffered damage. Tests would later show he'd lost approximately 15% of his heart muscle function, but he was alive. If Dr. Chen's refusal had lasted even 30 minutes longer, Raymond Dalton would likely have died in that emergency room or shortly after leaving the hospital. Dr. Patterson's quick action had saved his life. 3 floors below, in Dr. Thornwell's office, a very different kind of intervention was taking place. Victoria sat across from the hospital president and the board members, her hands clasped tightly in her lap. She tried to explain the exhaustion, the double shift, the years of burnout. Her words sounded hollow even to her own ears. Dr. Thornwell let her finish, then spoke carefully. "Dr. Chen, are you familiar with EMTALA?" Victoria nodded weakly. EMTALA, the Emergency Medical Treatment and Labor Act, was federal law. It required hospitals to provide emergency medical screening and stabilization to anyone who came to the emergency department, regardless of their ability to pay or any other factor. Refusing to treat a patient showing clear signs of a medical emergency wasn't just unethical. It was illegal. "You violated federal law," Dr. Thornwell continued. "You violated our hospital's non-discrimination policy, which you signed when you joined our staff. But more than that, you violated the most fundamental principle of medicine. First, do no harm. That man could have died, Dr. Chen. Not because we lacked the resources to save him. Not because his condition was untreatable. But because you deemed him unworthy of care based on his appearance." Patricia Nguyen leaned forward. "This isn't a decision we make lightly. We've reviewed your performance record. We know you've been an excellent physician in many ways. But excellence in technical skill doesn't excuse what happened today." The decision was unanimous. Dr. Victoria Chen's employment at Memorial Grace Hospital was terminated immediately. The incident would be reported to the state medical board for review. Whether she'd face additional sanctions, suspension, or restrictions on her license would be up to them. Within hours, Memorial Grace issued a public statement. Memorial Grace Hospital is committed to providing dignified, equitable care to all patients regardless of their circumstances. When that commitment is violated, we take immediate action. An incident occurred today that fell far short of our standards. The physician involved is no longer employed by this hospital. We have reinforced our policies with all staff and recommitted ourselves to serving every member of our community. The story broke on local news that evening. Social media exploded with reactions. Outrage, support for the hospital's decision, discussions about healthcare discrimination, and debates about physician burnout. The story touched a nerve because it highlighted something many people had experienced: being judged, dismissed, or treated as less than based on appearance. Raymond remained in the cardiac intensive care unit for 3 days. When he was stable enough to have visitors, something remarkable happened. Dr. Thornwell came to his room personally, along with James Wright from the hospital board. "Mr. Dalton," Dr. Thornwell said gently, "I want to apologize on behalf of Memorial Grace for what you experienced. It was unconscionable, and it will never happen again." Raymond, still weak but recovering, simply nodded. "I appreciate that, Doc." James Wright stepped forward. "Mr. Dalton, I'd like to talk with you about our Veterans Housing Program. We have connections with services that can help. Housing, mental health support, reconnection with your family if you're willing." For the first time in 3 years, Raymond Dalton allowed himself to feel something he'd thought was gone forever: Hope. This story isn't just about one doctor's failure. It's a window into a much larger crisis in healthcare, one that affects millions of people every single year. Studies show that implicit bias in medical settings is shockingly common. Research published in the American Journal of Public Health found that patients experiencing homelessness receive significantly different care than housed patients, even when presenting with identical symptoms. They wait longer for treatment, receive less pain medication, and are more likely to be discharged prematurely. One study found that homeless patients with chest pain were 30% less likely to receive appropriate cardiac workups compared to housed patients. This isn't just about homelessness. Black patients are systematically undertreated for pain compared to white patients. Women's symptoms are more likely to be dismissed as anxiety. Overweight patients report being told to lose weight regardless of their actual medical complaint. The elderly are sometimes treated as confused or difficult rather than listened to carefully. These biases aren't always conscious. Most healthcare providers genuinely want to help people. But implicit biases, the unconscious attitudes we hold, can influence split-second decisions in ways we don't even recognize. When a doctor is exhausted, overwhelmed, and running on empty, those biases become even more pronounced. And that brings us to the uncomfortable question at the heart of this story. Where is the line between understandable burnout and inexcusable cruelty? Dr. Chen's exhaustion was real. Physician burnout is a documented crisis. Studies show that over 50% of doctors experience symptoms of burnout, including emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Emergency medicine has one of the highest burnout rates of any specialty. Long shifts, impossible patient loads, and the constant exposure to trauma take a genuine toll. But here's the truth. Burnout might explain Dr. Chen's state of mind, but it doesn't excuse her actions. Plenty of exhausted, burned-out healthcare workers still treat every patient with dignity. They find ways to maintain their humanity even when the system is grinding them down. The moment we accept discrimination as an inevitable consequence of a broken system, we've lost something essential. After Raymond's case made headlines, Memorial Grace didn't just move on. The hospital implemented comprehensive changes. They established mandatory implicit bias training for all clinical staff, not a one-time seminar, but ongoing education. They created a patient advocacy position specifically to monitor treatment disparities. They partnered with homeless outreach organizations to ensure staff understood the complex factors that lead to homelessness. Most significantly, they established the Raymond Dalton Protocol, a system requiring peer review whenever any patient is refused treatment or care is significantly delayed. If a physician decides not to treat a patient, another doctor must independently evaluate the situation within minutes. It's a safeguard designed to catch bias before it becomes fatal. Other hospitals have taken notice. The story of what happened at Memorial Grace has been discussed in medical schools, used in ethics training, and referenced in policy discussions about healthcare equity. Raymond's experience, as painful as it was, has become a teaching moment for an entire industry. But perhaps the most important lesson is this: every person walking into a hospital, every person walking down the street for that matter, has a story. They have a history, contributions, loved ones, dreams, and dignity. The moment we start categorizing people as deserving or undeserving of basic human compassion, we've crossed a line that no amount of medical expertise can justify. Raymond Dalton wasn't just a homeless man. He was a veteran who served his country, an engineer who built critical infrastructure, a husband who loved deeply, a father whose daughters never stopped caring. He was a human being who deserved to be treated as one. 6 months after that fateful Thursday, Raymond Dalton stood in front of a community health conference, sharing his story. He'd moved into transitional housing through the veterans program James Wright had connected him with. He'd reconnected with his daughters, who wept when they saw him for the first time in over a year. He'd started attending therapy for his PTSD and joined a support group for grieving widowers. His heart would never be the same. That 15% loss of function was permanent. But Raymond had discovered a new purpose. He began advocating for homeless veterans, speaking at hospitals and medical schools about the invisible humanity of people living on the streets. When you see someone who looks like I did that day, he'd tell audiences, remember, you're looking at someone's father, someone's friend, someone who contributed to this world. You're looking at a full human being with a complete story. As for Dr. Victoria Chen, her path forward was more complicated. The state medical board suspended her license for 6 months and required her to complete extensive ethics training and bias counseling before reinstatement. She couldn't return to Memorial Grace, and her job search was difficult. The incident followed her. But eventually, a small community clinic took a chance on her, one that served primarily low-income and unhoused patients. Some might call it poetic justice. Others might see it as an opportunity for redemption. Those who work with her now say she's changed. She volunteers extra hours. She listens more carefully. She advocates for her patients with an intensity that surprises people. Whether she's truly transformed or simply learned to mask her biases better, only time will tell. Redemption isn't a moment. It's a daily choice. But here's what we know for certain. One moment of judgment nearly cost a man his life. One moment of cruelty revealed the gap between our values and our actions. And one moment of accountability reminded an entire institution why those values matter. Every person you pass on the street has a story you can't see from the outside. The homeless veteran. The struggling single mother. The person whose mental illness has stolen everything from them. Their circumstances don't define their worth. Their appearance doesn't determine their humanity. If this story impacted you, I need you to do 3 things. First, hit that subscribe button so you never miss stories that challenge us to be better. Second, drop a comment below sharing your thoughts. Have you witnessed moments like this? How do we balance compassion with the real challenges healthcare workers face? And third, share this story. These conversations matter. Next week, we're diving into another story that will challenge everything you think you know about justice, compassion, and the choices we make when no one's watching. You won't want to miss it. As Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Raymond Dalton's story proves that dignity isn't a privilege to be earned. It's a right that belongs to every single person who walks through those hospital doors. Every person has a story. Make sure you're someone who takes the time to hear it.